Hi everyone, my name is Leanne, and today I'm going to be going over the bony landmarks of the patella. There's only a few of them, so it should be a quick video. And I just wanted to let you know, if you didn't already figure it out, I have lost my voice, so I apologize for the scratchiness, but it'll be a quick video, so let's just get through this. All right, so this here is the patella. I'm going to label it up here. This is our anterior view of the patella. Okay, so normally I would ask whether this is a left or right patella, but it's going to be very difficult to figure that out and determine whether it's a left or right by just the anterior view. So what I'm going to do is I'm actually going to ask that when we're going over the posterior view, because I think it'll be a little easier to figure it out. So just give me two questions for this, two landmarks. This is going to be number 1. This is going to be number 2. So for those of you who hadn't had a chance to watch the other videos, the way that these videos are formatted and structured is that in the beginning, we're going to be going over in more of a quiz format. So I labeled these, and what you can do is you can take out a piece of paper and pause the video here, and you can quiz yourself to see how comfortable you are with the material. If not, you can always jump to the end. I will be reviewing all of the structures and going over a more in-depth review of it. Okay, so if you want to pause the video now, you can quiz yourself and see if you are able to determine what those two landmarks are. Okay, so number 1, we have the base, or on a quiz, honestly, I would probably put patellar base because it's always better to be more specific. Number 2, we're going to have the patellar apex. Oh, sorry, I don't know what that is. Apex. So the best way to distinguish between these two landmarks is that the apex is always going to be on the inferior side of the patella. And you can see here you have this little point. So that's kind of how I determine that that is the apex. But however you remember is fine. Okay, so now we're going to jump down here to the posterior view. Okay, so first what I'm going to ask is if this is a left or right patella. My next question is going to be here. This is number 2. What is that landmark? And this is going to be number 3. And the fourth question I want to ask that might appear on one of your quizzes on this or practicals is what bone / landmark question mark. I don't have enough room to fit all of it, but what bone and bony landmark do number 2 and 3 articulate with? Okay, so you can pause the video here and see if you can figure out the answers to these, and then I will go over them. Okay, so what I'm going to do is I'm actually going to go over the landmarks first, because I think by determining what landmarks number 2 and 3 are, it'll be a little easier to determine whether it is a left or right patella. So number 2, we have the lateral articular surface. So this kind of goes down to number 4, and this word articular kind of indicates that it is going to articulate with another bone. Okay, and I'm kind of running out of room here, but number 3 is the medial articular surface. So this is actually going to be a left patella, And the way that we determine that is that we see that this here, this area here, we know that that's our lateral articular surface and it's the posterior side. That's how you know that this has to be a left. If you kind of orient yourself, pretend that you place this patella right on the surface of your knee, it's gonna be your left knee because that is gonna be on your lateral side, this area right here. So that's kind of how you determine that. Okay, and then for question 4, what bone/landmark? The bone is going to be the femur, and the landmark is going to be the patellar surface. And if you can't really envision what this looks like or how that articulation, what it looks like, the best way I would say to do it is to go onto visible body. And if you look at the full body system, just bones, and you kind of look in, you can zoom in and you can see exactly where the medial and lateral articular surfaces, where they're going to articulate with the patellar surface of the femur. So if you want kind of more of a visual of that, feel free to log on to visible body to look more clearly at that. So this is a small bone. So this is all the questions I have for review for this one. But again, if you have any questions about this or any of the other bones, feel free to reach out to me or any of the other TAs. And I hope you can all use this as a resource to help with your studying for the practical this week. And I wish you the best of luck.